Hi everyone, thanks for listening to all my presentations. Today I'll be talking about melatonin. Before defining melatonin itself, I need to go over certain pieces of info. That's what we call a pineal gland. A pineal gland is a very small pear-shaped structure that some people call the third eye because despite its deep location in the brain, its secretion is largely determined by the presence of light or darkness. Its function or functions is or are obscured, but we know one thing for certain, that it can produce and regulate some hormones, and one of such hormones is what we are trying to address today, known as melatonin. Melatonin will be responsible to regulate sleep and wake cycle. So, melatonin is a hormone that is released from pineal gland when there is darkness. It helps in timing the 24-hour internal clock known as circadian rhythm. The level is not zero during the daytime, believe that, but it is several folds when it comes to the night time. So during the daytime when there is light, it doesn't mean melatonin is at level 0. No. But once darkness sets in, particularly middle of the night, the level will rise so high, incomparable to what the level had been during the day. Melatonin is oxidized in the liver by cytochrome P450 to 6-hydroxymelatonin, and then it will be conjugated or glucuronide and later excreted into urine and feces. A larger percentage of the melatonin will be found excreted into the urine or the saliva. In circadian rhythm, melatonin is very low under bright sunlight, that is during the day. It will be increasing in the level at the onset of darkness. It will peak between 11 p.m. and 3 a.m. and it will drop just before the onset of sunlight. That is why in wintertime, we sleep for longer hours. And in summertime, when many people will still be having sunlight at 10 p.m., or even in some zones where they are going to have light throughout the 24 hours, then sleeping will become a big problem based on this. But here is a big point. The alteration with darkness or light will not suddenly alter the concentration of the melatonin. But there are other endogenous signals that could also influence the level of melatonin. Let me explain. I have spent the last 2 or 3 minutes talking about how light and darkness will affect the level of melatonin, right? But that is not the end of it. There are certain endogenous signals that will also play one role or the other. And here we'll be dealing with suprachiasmatic nucleus of the hypothalamus that will send signals. Also retinohypothalamic tract and the superior cervical ganglia and even postganglionic sympathetic fibers that will re-enter the cranial cavity will all play roles here. The above will then explain why we'll be dealing with jet lag. Why that? Because there will be alteration in light or darkness that will not alter the level of sleep or wakefulness immediately until the endogenous factors will play the part also. Let me explain. What I've just said in the last 1 minute, the previous slide, is simply that light and darkness alone will not determine the level of melatonin. And that is why when you fly across geographical zones, you fly across the Atlantic, and then you are battling with jet lag. It is dark where you are right now, right? But based on what I've said before the last slide, you should be sleeping once it is dark, right? But that's not the case. And why that? The endogenous signals wouldn't have adjusted so quickly to the darkness seen as your destination. So that is why the circadian rhythm already built has not adjusted fully, and that's why you are dealing with jet lag. Melatonin level is also high for a longer time in fall and winter. Well, needless to say again, right? Because we'll be dealing with longer nights and it's going to be lower in summer. And why that? You know it. Because we'll be dealing with longer lights. Some have linked the variations in melatonin to causes of multiple sclerosis, seasonal affective disorder, and why that? Because there is a decreased flare in multiple sclerosis relapse during the fall. And that is the time that melatonin will be increased. Seasonal affective disorder is known as winter blues because it is increased in fall and winter. So, melatonin secretion starts at the third or fourth month of life. It will increase rapidly, causing nocturnal level to peak at age 2 to 3 years. Then, it forms a plate throughout early adulthood. Old adults will experience decline in melatonin level, and at 75, it will be very, very low. This explains why elderly people will usually sleep less compared to the newborn, right? Older people suffer the most, and whether the pineal gland is also undergoing degeneration. Everything is going downwards, right? This is one of many reasons why elderly people do have age-related insomnia. I can't count the number of elderly people that I've known that are on one medication or the other to help them sleep. Why? The older you become, the less effective the pineal gland, the less the level of melatonin, and the less the natural sleeping time or hours for you. What are the factors affecting melatonin release? Age. The higher your number of years in life, the lower the level of melatonin release. High age will lead to low melatonin level. For Pineal, that is a beta blocker, could alter the endogenous signals to pineal cells. 8. Methylpsycholine can inhibit melatonin metabolism. Caffeine and ethanol will have effects on melatonin release. Pupillary dilatation will increase melatonin because dim light will lead to dilatation and increased light will lead to constriction. Therefore, long time reading with a bright light or a very bright computer can affect your sleeping pattern. Or, let me simply put, can alter your circadian rhythm. And this will be helpful to the students, on campus when you have your computer before you and it's not having a bright light, or your cell phone is not having a bright light. Well, a dim light will help more of melatonin production, while a bright light will reduce it. Still on factors affecting melatonin release, bright light or devices at night can alter sleeping pattern by delaying time to sleep. So, if you have any medical condition that warrants you to have a good sleep, you know what? I'm spending my time on this because people are doing certain things that is not helping them to have a good sleep. And good sleep is very good for everybody, because you will be refreshed, you've relaxed while sleeping, right? You are awake, to your normal daily activities. And you'll be fine to drive and to focus, like medical personnel, pilots, drivers, anybody operating machines. You need good sleep. In fact, some people in pursuit of ability to be able to sleep well, they've died young. Yes, I repeat, they've died young because they will be taking so many medications to help them sleep. Sleeping is good for hypertensive patients because it is expected that the blood pressure should drop while sleeping. In fact, I personally have had situations when I guess that the high blood pressure that this man is dealing with is not a full diagnosis, just transient. I'll just give one of the benzodiazepines to make him sleep and then come back few days after and he's fine. Yeah, telling you the truth. Therefore, decreased sleep with decreased melatonin in old age people are all reasonable relatives that can make hypertension to go back or be on the increase. Let me repeat. You sleep less because there's decreased melatonin and you are already getting old. They are all related and they form additive effect that will worsen the hypertension for you. Sometimes in medicine, when we can't come down on specific cause of a problem, we name it idiopathic. So sometimes we don't know why it is like that. So it could be idiopathic. Uses of melatonin. Melatonin could be as a dietary supplement and could be physiologically occurring. So nocturnal melatonin can promote sleep onset and also maintain the same. For jet lag, we can use melatonin. For those having shift work, nurses, doctors, police officers, pilots, you can make use of melatonin. In age-related or age-associated insomnia, melatonin will be helpful. The dose of melatonin. Usually, now 0.5 to 5 milligram is within the normal range, but going through the literature, I found that some will be comfortable with 0.1 milligram up to 10 milligram. So you can give 0.1 milligram up to 0.5 milligram or 1 to 10 milligram at hour of sleep, and usually you give that 1 to 2 hours before bedtime. I'll talk more about onset of action in the next few minutes, but we need to talk more right now because if you want someone to sleep quickly, melatonin is not the drug of choice right now. No. This is not lorazepam. This is not diazepam. No, the onset of action of melatonin will not let you make it as a drug of choice for someone who must sleep quickly. No, but you can give it, and after a while, the onset will set. The higher doses can desensitize brain melatonin receptors, thereby altering the normal day or night melatonin rhythms. We should get that clear. Initially I said 0.5 to 5 milligram, but I found that some people will give as high as 10 milligram. When you give as high as 10 milligram, you should prepare your mind that you are cutting off the melatonin receptors and you are altering the day and night melatonin rhythms. Know that. Melatonin agonists. Melatonin agonists like Rabintion is good for chronic insomnia treatment. Others are tasimethion and agomelatine. What are the possible side effects of melatonin? You can have headache, confusion, fragmented sleep, somnolency, nausea, dizziness, supraphysiological concentration can lead to daytime sleepiness, impair mental and physical performance, hypothermia, and hyperprolactinemia. Onset of action. This supposed not to be an issue, but it's a big issue because I've seen cases when melatonin will be prescribed with intention of making the patient sleep quickly. That's wrong, please. That's wrong. So the onset of action is between 30 minutes to 60 minutes, and it could be as late as 2 hours before it will kick in. So if you want someone to sleep by 10 p.m., don't give it by 9:50 and think you turn your back and you come back by 10 p.m. and he or she will be snoring. You're not going to get that. You may have to be taken in for some days, like 5 to 7 days, before its full effect will show physiologically. But you don't have to prescribe melatonin for too long period of time. No. It can be in the body for as long as 5 hours. And let me explain certain things here. For the good nurses, you have taken the melatonin and administer to the patient by 12 midnight, and you expect the routine, activities like bathing, toileting, and morning medication to start from 5 a.m. before 7 p.m. because you need to round up 12 hours, right? You want to go home after 7, right? And you forgot that you've just administered the melatonin by 12 a.m. Here is the scenario. Your melatonin given by 12 midnight will start working around 2 a.m. This is expected to work till about 7 a.m. Now, you've come around 5 a.m. to tap that grandma or grandpa for daily routine. There'll be a fight. Why that? She's enjoying that good sleep by 5 a.m. And in fairness to you, the nurse, you need to do your work and round up and go home. But in fairness to that grandpa or grandma, the melatonin kicked in by 2 a.m. and she or he is expecting to have a good sleep while the medication is working. Now you've come around to alter that. There'll be a fight. So put that at the back of your mind that the onset of action is not immediate. And that will help greatly in helping the patient and avoiding unnecessary rift between the nurses and the patient, particularly the elderly on admission in the hospital. With that, I've come to the end of this presentation. Please remember to give thumbs up, remember to share, remember to subscribe. I appreciate it. Thank you.